Friends, I'm Asad Khan, Professor of Biotechnology at Aligarh Muslim University, Aligarh. Today, I'll talk on the very important issue, that is diabetic foot ulcer. Because the treatment of diabetic foot ulcer is almost fully recovery is almost impossible because of a drug resistance problem, and a lot of antibiotics is being given to the patient, but patients are not cured because of the same reason. The cells are getting resistance and the infection cannot be cured. And in that case, either a person has to be amputated, that is, his leg is being cut down because of this aggravated infection, or he has to wait for some more aggravation if it has not been amputated. So we have initiated some proposal on that, and we end up with a very effective treatment strategy where we use a simple nanocomposites with the dye and the laser light. So let's see, this is our conjugate, TBO conjugated chitosan AU, AG and P nanoparticles, which work under the photodynamic therapy, and it can treat easily the diabetic foot ulcer. I will show you some of the data where we publish and also patent in this research, where we found that see, this is a untreated mouse model where we have shown we have first generated the infection. So we first develop a diabetes, and then we develop infection through artificial means. And this infection is of a polymicrobial infection. It means that the two different type of bacteria are present in this infection, and these are the highly resistant bacteria used to infect these animal models. If you look this ulcer, which is untreated ulcer, and when we treat, this is the diabetic ulcer untreated, so it's more aggravated compared to this. Now, if you look the treatment strategy, so we use the core shell nanoparticles. The treatment is not fully recovered, but when we use the laser light and using these composite nanoparticle, then these ulcers are completely cured. And not only this, we have also checked them and verified them with certain other experiment in our lab, and these experiments prove that infection is fully recovered. So we did a lot of histopathology, then we use markers, and all these strategies, experimental strategies, proved that these infections are fully recovered. Now, this is a little technical slides where we have shown the reduction of the markers. So all these markers are inflammatory markers were reduced, are up and downs, whereas the infection goes down on the treatment with the laser technology. So the chitosan core shell gold silver nanoparticles are more effective under the laser light to treat this diabetic foot ulcer. Even the highly drug resistant strains, which are not cured by any antibiotics available, and these ulcers are fully recovered with this technology. Now, fortunately, we have been given a chance to move to human trial now, and now my research group is working on human trials, and we got approval from Ministry, Registry of India Registry, as well as from Ethical Committee, and so we are moving to attempt the human trials in a couple of months. If we prove them that it is the best technology to treat human diabetic foot ulcer, then probably that will goes to the market for the benefit of the human society. Thank you very much.